Hi, Dr. Wang here. Today I want to talk to you about topical retinoids. In the last 10 years or so, these topical retinoids have had a meteoric rise as an anti-aging topical drug for the skin. You hear people talk all the time how they wish they had discovered it sooner, and also talk about how they feel it's taken off years, even decades, off their skin. Today, I want to talk about how the medication actually works and the evidence behind it. I think after watching this, you'll realize the drug might not be everything that it's promised to be, and it might actually be a double-edged sword in terms of its benefits. Something that almost no one mentions is that once you understand how the drug works, it might actually be making your skin age faster. So the first thing to know is that there are numerous drugs in this class. Some are prescription and others are over the counter, and there's no guarantee that they all have the same efficacy. For many over the counter drugs and formulations, there's a ton of variation in which specific compound is being used and what concentrations they're being used at. And so with these, you have pretty much no guarantee that they are going to do what they describe. It's like an unknown Wild West out there, and frankly, a total crapshoot in terms of over-the-counter drugs of this class. Today, I want to focus on the prescribed form of this medication of topical retinoids called Tretinoin. This is the drug most studied for wrinkles and skin benefits, and it's the one with debatably the most evidence, and it's, I'd say reasonably, the one that's most used. Topical tretinoin is one of the few forms of topical retinoids with the labeled indication for treatment of fine wrinkles, mottled skin, and facial roughness, such as uneven skin. I just want to emphasize that in terms of topical retinoids, there's a ton of garbage out there that are over the counter, and this is one of the few ones with the labeled indication for use for fine wrinkles and skin blemishes, etc. This drug comes in various forms, from concentrations from 0.01% to 0.1% and sometimes higher, but the one most studied is the one at 0.05%. From the literature, there's a dose-dependent effect on how effective tretinoin is, but 0.05% seems to be the sweet spot in terms of side effects and also anti-aging, anti-wrinkle benefit. When the concentration of this gets really high, like 0.25% or even 5.0%, they basically end up as just a peeling agent at that point. Why is that, you might ask? Well, that's a good question and leads us right into how this drug actually works. So how it works is that it is a derivative of vitamin A. And what it does is it increases the mitotic activity of skin, which basically means it makes your skin cells divide faster. So in this process, by making skin divide faster and turn over faster, it also makes the skin layers less cohesive. So these things contribute in several ways to make the skin appear overall more youthful. The main one is that the increased skin growth activity makes the skin thicker, which means less wrinkles and younger appearing skin. Thin, uneven, or scarred skin is what makes skin look aged and wrinkled. And this basically counteracts that. The other thing is, with the decreased cohesion, it means that you're less likely to form comedones, which basically means less acne, less whiteheads, and less blackheads. Tretinoin is actually a pretty good acne medication. And by making the skin turn over faster, it can reduce uneven pigmentation by making the skin more uniform. So next, let's talk about some downsides and side effects of this medication. Like how it can treat hyperpigmentation, it can also cause hypopigmentation by the same mechanism, which means that you could end up with some unevenness where some areas are paler than others. And if you go back and think about how it works by making the skin grow faster and turn over faster, you can also have some local skin peeling and flaking. It can also cause irritation and inflammation of the skin. Because your skin is less cohesive with the faster turnover rate and the less cohesive structure of it, your skin is more vulnerable to chemicals, dryness, or blistering. Some precautions of this drug: if you have eczema or atopic dermatitis, it's a very common skin problem. This is not a good fit for you. So part of the problem with eczema is that the disease state of the skin causes you to have reduced skin cohesion. And the way this drug works is by making the skin less cohesive on top of that. So when that happens, it will readily flare people with eczema. Another group of people that should be very cautious with this drug are people who are pregnant or may likely get pregnant. This drug has observed teratogenic effects, which means it can cause birth defects. Next, let's talk about something that very few people talk about with this drug, and why I think that this really is a double-edged sword in terms of anti-wrinkle, anti-aging skincare benefit. And that is the mechanism of how this drug works. So let's think about it. What it does is increasing the mitotic activity of your skin, increasing the growth activity, increasing the division speed. So I don't want to get too deep into what telomeres are or how they work, but mitotic activity is directly related to cell line aging. So this increased mitotic activity could be accelerating your aging of your skin in the long run, despite it making your skin thicker, fuller, more youthful in the short term. And this perspective actually isn't that controversial. Not a single high-quality study exists that discusses its effects over the long term, like 5 years or more. And this actually isn't a particularly controversial opinion. Most reference literature, such as UpToDate and also the manufacturers themselves, they acknowledge that this is not necessarily a good drug to be using in the long term. In the 0.05% form, it's not recommended to be used for longer than 48 weeks continuously. So that begs the question, how long of a break do you need after, say, a 48-week course of this medication? Unfortunately, there's no real studies that have investigated this, and I don't have a good answer for you. So, in conclusion, topical retinoids are a huge category of drugs. There are a few good ones that have proven efficacy, but there are also a ton of unproven over-the-counter variants. So if you want a topical retinoid, I'd recommend you talk to your doctor and get a proper prescription form for something such as tretinoin at 0.05%. In studied forms such as this, it has proven efficacy for fine wrinkles, roughness, acne, and pigmentation problems. However, it probably should not be used for long-term therapy over 48 weeks in this 0.05% form, because it works by increasing cell division, and given this mechanism, it could possibly accelerate skin aging in the long term if continuously used. Other things, if you get easily inflamed skin or discomfort or excessive flaking of this medication, it's probably not the right drug for you. And lastly, this is a drug that you should actively avoid if you're pregnant or might get pregnant, breastfeeding, or if you have a skin condition such as eczema. So, thanks for listening today, and new videos every Saturday.